Welcome, alumni, students, parents, and friends of the Faculty of Mathematics, and as well as any others who are joining us today. It's wonderful that even in the midst of these difficult and extraordinary times, the Waterloo math family in China can still find ways to connect, engage, and share. My name is Mei Ying, a proud Waterloo math graduate, VP of Engagement of UW Alumni Chapters in Hong Kong, as well as your event host for tonight. Well, I can't believe it's already 2 years ago we hosted the first ever Dean's Lecture in Hong Kong. Over 200 guests attended the event at PolyU with fabulous feedback. It was such a huge success that many of you had asked for more. Unfortunately, we had to cancel our Dean's Lecture last year due to COVID situations, but we are determined to bring this great event back, despite all challenges, and here we go. Making tonight's event even more exciting is we get to meet our new Dean and President Designate. I will have the pleasure to introduce Dean Mark Giesbrecht, who will present President Designate Vivek Gowell to you all. Dr. Goel has prepared a brief talk especially for our guests this evening. Following this, we will be joined by members of the University of Waterloo's Chinese Student Associations, who will share a bit about the important work of the associations, one I was also a proud and active member of during my own time on the campus, as well as the rich history of Pi Day for mathies worldwide. Then Dean Giesbrecht will return to share with us his vision for the future of math and highlight a few exciting things coming out of your faculty. But first, let me introduce you to the Dean. Mark is the distinguished computer scientist who has nearly 20 years experience at Waterloo. Prior to this new role, he served as the director of the David R. Cheriton School of Computer Science from 2014 to 2020. He was also the associate director from 2009 to 2011 and director of undergraduate studies from 2002 to 2005 within the Cheriton School of Computer Science. Before joining Waterloo in 2001 as an associate professor, Giesbrecht worked at the University of Western Ontario, the University of Manitoba, and IBM Canada. He completed his bachelor's science degree at the University of British Columbia and earned both his master and PhD in computer science from the University of Toronto. He is a distinguished scientist of the Associations of Computing Machinery and served on several conference and general editorial boards, as well as the Neutral Sciences and Engineering Research Council committees. I hope you will join me in welcoming Mark into his new role as Dean. Before I turn it over to Mark, let me remind you that there will be time for Dean Giesbrecht and Dr. Goel to answer your questions following Dr. Goel's talk. I know they are really looking forward to hearing from you all. You may submit your questions through the chat feature. If you have issues with sound or video, please let us know in the chat forum as well, and a member of the math alumni team will assist you. Thank you for being here and enjoy the evening. Over to you, Mark.
Thank you, May. I'm so glad you and our friends and alumni in Hong Kong and China could join us for this special event. It is a lovely day in Waterloo, and I'm really looking forward to what we're about to do. Now, it's my privilege to introduce Dr. Vivek Gowell. Dr. Goel is a distinguished scholar with extensive achievements in research, teaching, and leadership across both public and private sectors. This July, he will become the 7th president and vice chancellor of the University of Waterloo. He is recognized in Canada and around the world as a leading public health researcher, health services evaluation expert, and champion for the use of research evidence in health policy making. Dr. Goel has held a number of senior research leadership roles at the University of Toronto, including as Vice President and Provost, and most recently as Vice President Research and Innovation. He served as founding president and CEO of Public Health Ontario from 2008 until 2014, and also in the entrepreneurial space as a founding scientist at the Institute for Clinical Evaluation Sciences, where he continues as an adjunct senior scientist. Dr. Goel has served as chief academic strategist with Coursera, a global flat platform that connects universities and learners with online courses. He's a member of the COVID-19 Immunity Task Force, chair of the Expert Advisory Group on the development of a pan-Canadian health data strategy, and scientific advisor for CanCOVID, the national research platform for COVID-19 research. Dr. Goel is also a fellow of the Canadian Academy of Health Sciences, and as of last month, and I'm very excited to say this, a member of the Order of Canada, one of Canada's highest honors. Dr. Goel received his medical degree from the University of McGill, and did research follow-up at the University of Toronto after that. So with all those honors, I look forward to working with Dr. Goel and to listening to his talk right now. Thank you.
Thank you, Mark, and thanks for that kind introduction. I'm just going to get my slides shared here. And good morning, good evening to everyone, depending on where you are. It's a great pleasure to be here for Pi Day, and I'm really looking forward to eating the pie that the Chinese Students Association has sent to me. So I'm going to just take a few minutes to talk about how data has been used throughout the COVID pandemic, and perhaps misused or not used enough, and highlight a few of the challenges that we've seen during the course of the pandemic and working with data. And I hope that will help set up for the Dean some of his visions and aspirations for the Faculty of Math at Waterloo. So, so the first thing I'll just put up here is a slide from an article that was published about 8 months ago. And it just shows all the ways in which digital technologies have been or could be used during the course of the public health response. And you can see a broad range of applications as well as analytic tools. And I'll highlight examples from a number of these areas over the course of the next few slides. So one thing that I think we're all familiar with is mathematical models. And I'm sure a year ago, many people in the world had never heard of infectious disease mathematical modeling, but it's been a field that's been around for many decades, close to a century certainly. And very early on, this Imperial College mathematical model got a lot of attention. What it was showing in the black line is the number of cases that might be projected if nothing was done early on in the pandemic about a year ago this time, and with a range of different measures, what could be achieved in number of cases. And the red line along the bottom was for the UK, this critical care bed capacity. And so obviously this would have been overwhelming. And what you wanted to do was, as we came to learn about a year ago, we used the term flatten the curve and minimize the number of cases. This model, along with others, has been criticized for being off, but models are, by their very different definition, predictions. And just like the weather forecast comes true sometimes and not sometimes, models are used to guide our decisions, but are not meant to be exact predictions of the future. And it's fair to say this, along with many other modeling groups, have been very important and continue to be very important in guiding our response to COVID-19. But one of the critical things is calibrating these models, making them better, requires data in real time to help inform what is happening. Another area where we can see some wonderful applications of using data and new tools such as machine learning is actually in predicting who will get sick and who will get severely sick. And this is a busy slide here, but was showing what the risk of death is by age group and sex over here, and different risk factors. Might be hard to read, but for example, age and the relative risk of death as you go into older age groups, and up to 15 times higher risk for someone getting COVID-19, 80 plus relative to the reference population, which is 50 to 59. People with different conditions, people who are obese, people with kidney decisions, and so conditions, number of medical conditions all have higher risks. Interestingly, this also showed differences by race and by what's in the UK known as deprivation index, essentially a measure of socioeconomic status. And the most deprived people had a much higher risk of death than the least deprived people. What's really amazing is this work was done with the electronic medical records for 17 million people in the United Kingdom. And it was able to be published in a matter of weeks of the analysis being done. A decade ago, work like this would take years to collect the data, to do the cleaning of the data and the analysis. And during the course of the pandemic, we've been able to see work like this being done with these sorts of systems in matters of weeks and months. This was an interesting application using a smartphone app for recording symptoms. And people were signed up to put daily symptom recordings. They then tracked who got COVID-19 over a period of time, and they were able to see which symptoms were predictive of getting COVID-19. And this was not known to us a year ago, that loss of smell, anosmia, was going to be a very strong predictor of developing COVID-19 in the days that you develop the disease and get tested positive. So it's a great example of how using digital tools such as smartphone daily check-ins for symptoms linked to COVID test data was able to quickly turn around very important information that we have a unique, relatively unique characteristic for predicting that someone is about to develop COVID-19. A very critical area has been genomic surveillance. And this is the means by which we've been able to pick up the variants of concern, which are of significant concern throughout the world right now. What this is showing is what's called a genomic phylogenetic tree. And it's the different virus strains from the original virus, which was first detected in Wuhan, China, to the very early branching, the 20A here, which is the virus that spread in Europe and then largely into the Americas later on. So, and over here we can see the different distributions of the strains. What this really has allowed us to do is watch evolution in real time. Never before in a pandemic have we been able to watch the specific evolution of the virus as it's moved through different parts of the world. But this is not just a lab achievement. The genomic sequencing of the viruses happens in labs. But what we've seen is until bioinformatics capacity, the capacity of the big data that comes out of all of those viral genome sequences is unleashed using very powerful computation tools, can we generate these kinds of trees and detect which are the variants, where are they emerging, and what impact they're having on the population. Big data has also been incredibly important in the development of therapeutic drugs and vaccines. And this chart just shows the different levels that we go through from the very genomic level through proteomics to the organs and to humans. And at every step of the way, data is required in order to actually figure out what's going on. So if you want to look for promising drug candidates, we take the protein we want to target, the spike protein as it's known of the coronavirus, and we look for drug candidates that are in libraries that might fit that particular target. And that is done again through large scale computation. You can go through millions of potential candidates, both previously observed as well as potential new candidates. And similarly, at each step of the development process, computation comes in order to do the work. And a similar thing with the development of vaccines. It is incredible that a year into this pandemic, we are rolling out vaccines around the world. Many people, myself included, thought it would take years for us to develop a vaccine, to test it, to do the clinical trials. But a significant reason why the vaccine was able to be discovered so quickly and developed was that once the genome sequence was posted by the Chinese government in the middle of January of 2020, Moderna was able to develop target vaccines based on high performance computing calculations based on that genome sequence, what proteins are necessary to target. They were able to have potential vaccine candidates by the end of that month, so that by the end of January, and by about March of last year, they had potential vaccines developed and ready for the very first early animal experiments and then the clinical trials. So again, incredible amount of science predated that over the last 30 or so years with messenger RNA vaccine development, but then it's the computation power that really enabled the rapid development and deployment of the vaccines into clinical trials. And then as the vaccine is rolled out, first of all, we were able to see the trials done incredibly quickly. But this is a study that was just posted a few weeks ago out of Israel, which looked at over 1 million people that had the earliest vaccines. And what's really amazing about this study shows the incredible difference between the people that got COVID-19 and those who were unvaccinated and those who were vaccinated. They were able to look at over 1 million people from their health maintenance organization. They were vaccinated between December and February 1st. They were followed up for 2 weeks, so through to February 14th, or maximum of 2 weeks. And the paper was published in the New England Journal of Medicine on February 24th, 10 days later. And again, as with the earlier example, they were able to do this because they had electronic medical records for all of those people, and they were able to link their vaccine histories, their medical histories, and their COVID outcomes all very quickly. It's not all rosy. I've got here the Johns Hopkins tracker for COVID cases. It's an incredible amount of information on this dashboard that they started doing last January and is now the go-to place for the media and even for people in public health throughout the world to find out what's going on. And the question I would pose is, why is it that we go to a university website to find this data? And it's because our government systems, either our agencies in our own countries or the World Health Organization, weren't actually able to mobilize and create the tools to create these kinds of visualizations in real time. We've had to reach out to the private sector to get data on what's happening in our population as the controls are put in place. And so this graphic is showing mobility trends based on cell phone data, and for different provinces in Ontario shows that in the first wave, we had a very dramatic decline with the relatively harder lockdowns. In the second wave, we had declines, but not to the same degree. So this type of data has been very useful, but has also been challenging to get because of privacy concerns. Both a positive and a negative in terms of social media. We can use social media to look at trends in sentiments. How's the population doing? Negative and positive sentiments over time in the first wave. But as we also know, social media has been a tool for the spread of disinformation and misinformation. And we've been able to use data when it's available to look for disparities. As I showed earlier, there are disparities in outcomes. Here in data from Toronto, we can see the disparities in the share of cases relative to the share of population in green. So the lowest income people have 14% of the population, 23% of the cases. The highest income people, 21% of the population, 9% of the cases. Again, this data can be challenging to derive and get at. So just quickly to wrap up a few of the challenges with data, and it has hampered certainly our ability to respond to the pandemic in Canada. And one of the activities I'm now engaged in is the development of a new pan-Canadian health data strategy to help overcome these challenges. And I'll highlight a few of them. There's timeliness of data. There's steps from when someone actually develops the symptoms of COVID to when they get tested and it gets reported. You can see here the number of days. It takes 2 days from symptoms to specimen collections for about half the cases. It takes another day for up to 3/4 of cases to get the report out. So we have built-in delays, and then we have delays in actually getting the data from the lab to the public health authorities, getting the data all integrated together. So the data that our federal government puts out can be up to a week or 10 days behind when the symptoms actually developed in someone. Our death data can be delayed. So we do have to work on how we can get data in a more timely manner. The actual completeness of data can vary over time. And so the gray here outlines what the source of acquisition of a case was, that it was missing. And you can see a substantial portion were missing. But the yellow is cases for which no epidemiologic link was identified. So that starts to get to about 1/4 of our cases. We either have no information or we can't establish it. And in many of our cases, we don't really know details about was it acquired at a restaurant or a gym or other place. It's simply specified as community related or outbreak associated. So the detail in the data can often be missing, which hinders development of decisions. And so what we wind up with the situation is we have lots of data available, we have lots of data being used, but we don't necessarily have the supply chains for the data to move it from where it's being generated to where it can be used. And there are many reasons why that happens. I won't, in the interest of time, I won't go through all of them, but I just highlight one, which comes up over and over again, and which is concerns about privacy. And what's important to know is it is essential to keep people's privacy rights, but we have to do it in a reasonable manner. And during the course of COVID, we have infringed on people's civil liberties, stay-at-home orders, in many significant ways. What we haven't done is we haven't asked people, would you be willing to share your data in order to inform the course of the pandemic so that you have less infringement on your civil liberty? And if our politicians were to frame the discussion with the public in that way, I think we would find many people would be willing to share their data in order to have less infringement on their civil liberties. And we can also work with data in a privacy protecting format. And there's lots of mathematical tools being developed that enable data to stay where it's secure and for analysis to be done across platforms, as an example. So I won't go through this slide. It's just highlighting what ideal system for the flow of data and information into analytics could be like. But I'll just leave you with 3 important points. We've been living in a world that's being transformed by data for the last several decades. What the COVID-19 pandemic has shown that transformation is fully upon us, and we're now in a period of really figuring out how we live in this data-driven world. And the 3 critical issues that I think need to be addressed are this issue of data access. In a data-driven world, we need data to be able to flow easily and quickly. Data literacy. Every single person in the population needs to be able to understand what data means, how it's generated, how it's analyzed. Even if they're not mathematicians or computer scientists or statisticians, they need to be able to consume the information that comes from that range of expertise. And the final point I'd make is data equity. We need to live in a world that data flows and is accessible to and is generated from all of our communities, all of the regions of the world. Because if we have gaps in our data, we will have people that will be left behind. So thank you very much for your attention, and I look forward to the discussion.
So thank you, Dr. Goel. I really appreciated the comments. It's very exciting to see sort of the power of this sort of deep computational and mathematical analysis and how quickly it's been brought to bear. I mean, that really came out. I also really appreciate the plea for education in data science and sort of that, you know, the broader mission beyond the mathematicians and the computer scientists. So I really appreciate the talk. We do have some time for a question or two. If our guests would like to participate, they may pose their own questions in the chat feature, and a member of the Math alumni team will share them with us. Let me start with a question of my own, if you don't mind. The feature analysis here that you did was, you were sort of identifying features and their importance. What was the most surprising feature that was sort of that you pulled out that you weren't expecting, and that was not something that you went into the analysis of the data with?
Yeah, so certainly as I pulled these slides together and I was looking through some of the articles, I've been following this obviously because of the work I do very closely over the course of the past year, but I was actually unaware of the symptom tracking study using, it's a very simple app that people could download. I think it was actually started by Fitbit, and so it gets to some of the equity issues, right? Who were the users of that, and so on. But I hadn't actually seen that was one of the studies that picked up on the sense of smell being such an important predictor, because that was something that had not been associated with a lot of infectious diseases before. So it was a bit of surprise when it started to come up last year, but that power of it. And what it really highlighted again for me is this intersection of new digital technology, smartphones and apps and so on, with things like epidemiological work. So, again, to do a study like that, when I was training as a public health physician, you'd go to where an outbreak was, you'd ask people what symptoms you had. And so you get into recall bias. Do they remember what symptoms they were? They may think, people may be more likely to remember loss of sense of smell because it's so unusual, right? But here, this data was actually collected prospectively. They were putting in these symptoms every day, and then they got tested for COVID-19. That would have been very hard to do before there were smartphones or tools like that around.
The one that struck me was the insomnia, which could also be tracked by a Fitbit, which is, monitoring our sleep, how good a sleep we had, and that's something that would show up. A question coming in from the audience is, you said data literacy is key. Is this an area where you think Waterloo Math can play a role? And of course, you're speaking to, many Math alumni here.
Yeah, and certainly, and as I should note that the dean was on the selection panel for for my appointment, and I think it's something that is very dear to me, and it's one of the things that attracted me to this role at the University of Waterloo, as I think about what a post-pandemic university has to be really focused on. And there are areas like this that I would like to make sure that we really start to look at what are the opportunities for every graduate of the University of Waterloo to have a basic understanding of data literacy, and can that be brought into, it doesn't mean that everyone has to go do a math or stats course, right? You could work with faculty in other disciplines to bring in concepts of data and understanding of data into their courses. And so if we can set a bold objective that every graduate of the University of Waterloo and become the model for the world on how that happens. And ultimately, it's not just about university graduates. We have to think about people who don't go to university. I was just watching on the news this morning, the news anchors debating the effectiveness numbers about the different vaccines, right? And it was clear that they're not going to go and read those papers in the New England Journal of Medicine and so on. But they should be able to look at the kind of graph that I put up and understand what it means. And I think that's the goal that I would have, that people could look at things that will be coming out and really understand what they mean.
Thank you for that. I mean, I see it as an analog to language literacy, which we all take for granted, and this is something which corresponds. And I think we now, perhaps, if one of the positive things of the pandemic has been sort of a recognition of the power of analytic thinking, but also of science to deal with these great societal problems. So with that, I would like to thank you for joining the Faculty of Mathematics and our alumni and friends in Hong Kong and China today. I'd be remiss on March 14th, Pi Day, if I didn't ask you what your favorite flavor of pie is.
Apple pie.
Apple pie. Okay.
Thank you to the students for bringing it to me.
Okay. Thank you, Dr. Goel. We all look forward to working with you. Take care and have a good day. So have a great Pi Day. So in honor of Pi Day, we've invited David Zhang and Sam Yu from the University of Waterloo's Chinese Students Association to introduce you to the significance of this very special day. And while they do, we would be interested to hear from the audience in the chat feature, what is your favorite flavor of pie? We want to ensure you that when we can be in person next year, we're going to have plenty of pie, and we're going to take advantage. We're going to analyze, collect the data of your choices, and make sure these choices are on hand.
Hi, my name is David Zhang. I'm the co-president of the University of Waterloo Chinese Student Association and a current undergrad of the Arts faculty. I welcome all alumni, students, family, and guests, and everyone joining us through the UWCSA Facebook page. As the co-president of the association, I am delighted to be here this evening to officially welcome President Designate Vivek Gowell. We look forward to meeting you in person when you join us on campus in July. In the meantime, UWCSA is a cultural Chinese social club designated to help all students of all cultural backgrounds to meet new people and have some fun while on school. UWCSA hosts events from cultural night markets to Chinese New Year events and to meet and greets with prominent Chinese-born celebrities in North America. UWCSA is currently hosting a massive Facebook group called UWCSA Alumni that is open to past and current UWCSA executives. Now, it is my pleasure to introduce one of my own executive colleagues, Sam Yu. Sam is a current math student and UWCSA's very own Vice President of Operations, and will provide an introduction to one of the tastiest days on campus, Math Pi Day.
Thank you, David. Welcome, Dr. Goel. My name is Sam Yu, and I'm the Vice President of Events and Operations for the University of Waterloo's Chinese Students Association. I'm also a third-year undergraduate computer science student at UW. As a student in the Faculty of Mathematics, it is my honor to introduce you to our very special Faculty of Mathematics tradition, Pi Day. As a former Mathematics Society board member once put it, it is our one internationally recognized day for math pride. Surprisingly, it is the one day of the year where students across campus suddenly become mathies to enjoy a slice of pie. Pi Day was founded by Larry Shaw in 1988. It is the unofficial holiday that celebrates the mathematical constant pi. As such, it is celebrated on March 14th to correspond with the first three digits of pi, 3.14. Enthusiasts all around the world celebrate Pi Day through a variety of pi-themed activities and contests. March 14th also coincides with Albert Einstein's birthday. And interestingly, it is also the birthday of the university's first B-Math recipient, Jean Elizabeth Ant, from the faculty's graduating class of 1967. On March 14th at precisely 1:59 p.m., pie is served on the third floor of the Mathematics and Computing building. Students have been known to stake out their place in line well before noon. I know I have. Over 1,000 slices of pie are cut, served, and eaten in under 3 hours. While we can't be in person this Pi Day, we are very much looking forward to you joining us next March 14th on campus to enjoy a slice of pie and perhaps take your chance at our very fun and only slightly competitive pie recitation contest. This contest challenges students to recite from memory as many digits as they can of the mathematical value of pi. It's very impressive. We will be sure to let MathSoc know to have lots of apple pie on hand as he hears your favorite, and David, and mine's as well. Happy Pi Day, Dr. Goel.
Thank you, David and Sam. Apple certainly is a popular choice, but I've done some very deep data analytics and decreed that my favorite continues to be lemon meringue. And so I'll join you in some pie. Get some good lemon here. And then, of course, you get to watch me eat. But I'll be interested to see what the top choices from our guests are. I'd also like to take this opportunity to thank the Chinese Student Association for their assistance in today's program. In fact, we have a couple of volunteers, Miley and Lucy, on site today, masked and helping behind the scenes. And I'd also like to thank the great team here in front of me that you can't see, especially Katie Dick, who's been essential in putting together all this production behind the scenes. In lieu of gifts for today's presenters and volunteers, especially for the Dean's Lecture Committee led by this evening's host May, we'll be making a donation to the Chinese Students Association. If you'd like to find out more about the work and activities of this important student group, a link to their Facebook page was included with your event invitation and will be shared in the chat. Now, as May shared at the start of the program, I'm Mark Giesbrecht. I'm a professor in the David R. Cheriton School of Computer Science at the University of Waterloo. And as of this past July, I'm the new Dean of the Faculty of Mathematics. Before this, I served as the Director of Computer Science for 7 years. And these were really some of the most rewarding years of my academic career so far. I worked with many exceptional faculty, staff, students, and alumni. I hired more than 25 professors in the Cheriton School of Computer Science. And I saw firsthand the incredible depth of talent, collegiality, and goodwill in the faculty, staff, and of course the students. We'd like to take a few minutes to share I'd like to take a few minutes to share with you a few of the exciting things underway in the faculty and things that I see are going to be very exciting going forward. So this is my first opportunity as Dean to speak to our alumni and friends in Hong Kong and China, and it really is a pleasure and an honor. It's thanks to you and your many accomplishments that the Faculty of Mathematics continues to enjoy the respect and admiration in this region and across the world. As the leaders of a thriving innovation ecosystem here in Hong Kong and China, you truly exemplify everything the Faculty of Mathematics stands for. So let me start by saying thank you for being such incredible ambassadors for our faculty. So why did I choose this Hong Kong to be the location of my first international event as Dean of your Faculty of Mathematics, albeit virtually? That's easy. Because as this is a photo taken at the 60th anniversary gallery showcases, this community has always been and continues to be one of the faculty's most active and engaged alumni communities. I'm proud to say that the university has over 3,500 alumni across China, nearly half graduated from the Faculty of Mathematics. We are deeply honored that you continue to entrust us to educate and graduate more of the exceptionally bright minds from here each year. For this, I really am deeply humbled. Our alumni have made scholarships available to encourage and attract the best and brightest students from here, including the Board of Governors Chair, Cindy Forbes. Cindy has sponsored an entrance scholarships in mathematics for an outstanding student from Asia. As well, we're proud to award both the Ivor Chow and Sammy Chan entrance scholarship in mathematics. And this community continues to open up important experiential opportunities for students. In fact, between 2018 and 2021, almost 500 employers in China hired over 15,000 Waterloo math graduates. And more than 1,200 employers in China hired 65,000 UW graduates. I would be remiss if I did not add here that with so many of our students local to this community, we would always welcome adding new and exciting co-op positions for our current students waiting in the wings. We also continue to be incredibly appreciative of our alumni who give selfishly of their time and talents to allow us to stay connected to this important community. I'd personally like to thank this evening's host, Mei Eng, and the Dean's Lecture Committee for their leadership and dedication in bringing you the events, as well as our inaugural lecture in 2019. For these reasons and many more, it will come as no surprise that when deciding to launch our Dean of Mathematics lecture series in March 2019, we did so right here in Hong Kong. While early days of COVID did not permit us to return last year, we simply couldn't let another year pass without bringing this important event back to you. We hope next year will allow you to do that. We will be allowed to do this in person. I would also like to share, should the environment allow, I am very much looking forward to meeting each of you in person this coming fall. So this presentation that I'm about to give will give you a preview of Maths faculty's future. But first, let me update you on this past year. Because of course, it's been an incredibly challenging year, as I'm sure each of you is aware. COVID-19 has forced us to reimagine everything, from how we deliver education, to how we conduct research, and to how we engage with our community. Yet the Faculty of Mathematics has in many ways been built upon challenges like this. And throughout the year, we have demonstrated tremendous resilience, adaptiveness, and ingenuity. So let me just give you one example. When the global pandemic shut down schools across the country and around the world, the Center for Education in Mathematics and Computing, the CEMC, launched an online tool to help children and parents continue with their math and computer science education from home. This was a huge hit. Their courseware page received over 3.1 million views in April 2020, the same number they saw in the entire previous school year. Overall in 2020, the courseware page received over 14 million page views from people in over 200 countries using their programs for over 500,000 hours. This is truly impressive. I'm sure many of you are familiar with the great work of CEMC. In 2018 and 2019, over half our non-Canadian participants in math CEMC-run events were in competitions and came from Hong Kong and China, and did exceptionally well, which is a truly remarkable achievement. It's because of stories like this that I believe the faculty will emerge from the pandemic stronger than ever, ready to tackle the biggest challenges of our age. Some of these challenges Vivek Gowell, our incoming president, outlined, and I'm truly looking forward to working with him on this. What are the challenges we plan to tackle? Well, one of the most important ones, and one I'd like to focus on in this talk, and one that Dr. Goel also focused on, is the power of data to shape our society, and the power of mathematics and Waterloo mathematics to shape data. So this is Chris Bao, professor in applied mathematics. And this is Chris, and in a New York Times article that appeared a couple of months ago. And Chris is an expert on modeling infectious diseases. During COVID, he created models to address difficult questions like how can provinces reopen schools safely? What should the capacity of classrooms be? What's the correct order to roll out vaccines? His work has given our leaders essential guidance on how to make the most difficult decisions over the past years, and to make these decisions in a rigorous way in which the maximum number of human lives can be saved. But what's unique about Chris Bao is that he isn't satisfied with traditional mathematical modeling. Rather, he's seeking to make models that are more accurate by integrating new data sources like social media, sources like mobility data, and employing and extending the latest research from game theory and from machine learning in creating models that truly do predict accurately what is happening in the world. And he's not the only one. We have many other exceptional researchers in applied mathematical modeling, bioinformatics, biostatistics, and data science, some of whom you'll see in the talk below. So this is one of my favorite slides, just because it's from a magazine I very much value, and it's about the world's most valuable resource. So Chris's example points to incredible usefulness of data today. A data-driven revolution is well underway in society and in academia, and it's transforming every sphere of life. Vast amounts of data are being generated every second, which, when effectively analyzed, can yield insights, enable us to enhance healthcare, fight climate change, construct smart and sustainable cities, and to drive our economic growth. Yet our ability to analyze, secure, and employ the existing data remains limited. As a result, the full societal impact of these technological advances has yet to be felt. The Faculty of Mathematics has a major role to play in realizing the full potential of the data revolution that's coming. So, of course, why us? Why Waterloo? And I think I'm speaking to an audience that knows the incredible depth and value of Waterloo, but I want to point to some current statistics that I'm very proud of. These are from rankings that came out in the last couple of weeks. In computer science, in the Cheriton School of Computer Science, we're number 23 in the world. In mathematics as a whole, we're number 35 in the world. And both in computer science and in mathematics, we're number 1 in Canada. So I have a picture. I like this picture because I think it says something about why mathematics. And as you know, mathematics at Waterloo is a big tent. It's a tent that brings in 5 departments. It brings in computer science. It brings in statistics and actuarial science. It brings in applied mathematics, pure mathematics, and combinatorics and optimization. And in my mind, the power of mathematics at Waterloo is in the confluence, in the connection between these fields. Math at Waterloo is, I believe, the only dedicated faculty of mathematics in Canada and one of the very few in the world. We are bringing together unique disciplines crucial to the 3 unique disciplines crucial to data science: math, statistics, and computer science. And it's at the intersection of these that the truly transformative field of data science operates. Our goal is to build upon our pre-existing strengths to establish ourselves as one of the world's foremost leaders in data science. By connecting our researchers and building partnerships with industry, we aspire to drive innovation at every step of the data processing pipeline, from data management to security and privacy to analytics and entrepreneurship. So in this presentation, I wanted to focus on just a few aspects of this vision. The first of which is the application of data science to health. COVID-19 has exposed many vulnerabilities in our healthcare systems, vulnerabilities that must be addressed before the next crisis, whether this is a new pandemic, the impact of our aging population, or the health effects of climate change. Math and computer science provide a way forward. From advanced mathematical modeling to bioinformatics and biostatistics to big data analysis, mathematics is powering a revolution in healthcare. And our Faculty of Mathematics is a leader in this area. You see in this slide Professor Anita Layton. She's our Canada 150 chair, doing modeling of blood flow and kidney function. I wanted to bring up a sample of some of the other people we have working in mathematical and computational health. These are my colleagues who I love to work with them. I mentioned Anita. Bin Ma is doing bioinformatics and is doing protein sequencing. Jimmy Lin is looking at mining databases and doing information retrieval on the Neural COVID initiative, which applies neural networks and AI to answering questions about COVID-19. Richard Cook develops and applies statistical methods for public health research. And Ming Li is using machine learning to develop personalized cancer vaccines, and has a brilliant new paper in Nature, one of the top journals in the world in this field. But Waterloo is also about taking these great innovations that we have, these innovations in mathematics, these innovations in computing, and to taking them into the industrial world, to taking them into the entrepreneurial space. Waterloo as mathematics has always excelled in taking research into this through partnerships and entrepreneurship. And one of my goals as dean is to ensure that entrepreneurial spirit flourishes into the 21st century. Students and researchers in our faculty have always been bold and visionary creators. After all, University of Waterloo's first startup, Watcom, which is now SAP, launched out of the Faculty of Mathematics in 1979 and went on to transform the landscape of computer programming in ubiquitous languages like Wat4 and Watball. And some of the older alumni that I'm speaking to will remember programming on these programming in these languages as students. There's been over 500 startups that have their origins in the Faculty of Mathematics. This was the Watball and Wat4 and where Watcom was the start of a proud entrepreneurial tradition that remains strong today. This accounts for, this 500 startups accounts for only the ones that come directly out of the faculty. There are many more startups that have been launched by our alumni, including Bowtie, an online medical insurance company based in Hong Kong by Fred Nan and Michael Chan. Today, in the face of unprecedented health and economic crises, we seek to build on this tradition. We have the best faculty and the best students in the country, and we want to encourage them to think entrepreneurially about their studies and their research. So how do we do this? So currently, we're planning to develop a suite of resources that will integrate entrepreneurialism more deeply and seamlessly into our education and research culture. This will enable us to become a leading source of end-to-end solutions in data science, from discovery to technology to commercial product. In conclusion, I want to emphasize how we value our relationships with Hong Kong and China. As we move forward, I hope to strengthen the Faculty of Mathematics connection to your region. I have personal family and research connections to China, and I think I've visited there almost every year for the past 20. I know how to promote I know that by promoting a vibrant exchange of ideas and talent, I believe we can tackle together some of the biggest challenges and foster the kind of prosperity we all aspire to. With this in mind, I very much want to hear from you about this presentation. Our faculty can only succeed by harnessing the insights, energy, and passion of our talented alumni. By sharing your feedback and wisdom with us, you can help to realize its full potential as a powerhouse for innovation. If you wish to get involved, there's always a lot you can do, from volunteering to sharing your story to helping make connections in the region. I've highlighted a few key contacts that you can reach out to for more information. So thank you all. It's been a real pleasure and an honor to speak to you today. I really look forward to doing this in person in the coming fall. Thank you very much.
Thank you, Mark. You and Dr. Goel have certainly outlined for us an exciting vision for the future of the Faculty of Mathematics and its unique position to seize this moment in time to address global and community challenges for the betterment of society. Thank you for taking the time to share your goals and objectives with everyone joining us today. Certainly, some of the themes you have touched will be reflected in the keynote lecture just ahead. I think soon at around 10 p.m., Professor Jochen Kuhlmann will present this evening's featured lecture, Harnessing Mathematical Programming to Solve Problems Ranging from Worldwide Transport to Healthcare. And I'm very much looking forward to this talk. But first, let's have a look at this short video.
In our world, we are surrounded by optimization problems that are simply hard to solve. In Sick Kids Hospital, they told us about this project. These children born with craniosynostosis.
The bones in the skulls starts fusing much earlier than they should. That starts creating deformities on their skulls.
But sometimes, because of pressure, you have other problems. It's something that people need to correct.
The surgeons cut the bone and then they reshape it. It relies essentially on the surgeon's intuition. They asked our help to do this in a more methodical way. And I thought, wow, this is great. If we can do something that can help.
So our algorithm presents a systematic way to look for the right cut positions. Our algorithm allows the surgeon fewer cuts, shortening the amount of time it takes to operate on a patient. To find something that helps not just the bottom line of a company, but in the lives of other people is rare. I want to do this. Optimization is a field that deals with ways around these bits of hardness. And it takes a lot of mathematics to prove that your algorithm is good.
these mathematical optimization techniques, they could be applied to so many fields.
There are many ways in which this project can go further. There's a more complicated type of surgery where you operate on the entire skull. So how to do that, where to cut, is a much more complicated problem, and we are working on that right now. We love what we do, and sharing is what we want to do with our work.